Thank you for joining us today for our part 12 of our coronavirus update. For those that haven't joined before, I've got a little bit of housekeeping just before we get started. So this is a broadcast, so unfortunately we can't hear any of your audio. I have got a slide after this one that shows where you can put any questions, because we're going to save a bit of time at the end for some live Q&A. Hopefully you can see my screen, hear my audio. This session is being recorded, so don't worry about scribbling down loads of notes. We will get out a recording to you post-webinar. Introductions for today. So we've got Audrey Robertson, who heads up our HR consultancy. We've got Philip Barker, who heads up our health and safety team, and we've got Michelle Hobson, who is our HR services director here at Morpay. They're going to take you through the content and hopefully answer any questions you've got at the end. So in terms of agenda for today, we've got half an hour scheduled in. We may go slightly over. Again, don't worry if you've got to drop off at 10:30. The recording will continue and we can get that out to you. In terms of what we're going to go through, we'll start off with what's new, what's been updated from the government on the coronavirus. We're going to have a discussion around health and safety and around protecting your employees, PPE equipment that you should be using, how to use it. Then we've got a slide on how we can support you and your business to ensure that you're compliant. And then also, as I mentioned before, we're going to finally finish off with a live Q&A. So I mentioned before around questions. On my window, it's on the right-hand side. There should be in the GoToWebinar, there should be a questions box. Throughout the whole webinar, if you've got any questions that you want answering, put a question in there. I'm not going to mention who's asked the question. I'm just going to answer it. Typically, when we do these, we do get quite a lot of questions. So the fact that I know who's asked it just means that I can go back to that person post-webinar and we'll come back with an answer. So any questions you've got throughout the webinar, please pop them in there. So with that done, I'm going to pass over now to Michelle, who's going to take us through the current stats. So over to you, Michelle.
Thank you. So just to kind of recap on where we're up to, I'm sure in various guises you're all following the media, but I do think it feels like we're getting to the point where there is so much information out there. It is very difficult to know where you should be looking and how you should be interpreting it. I think one of the things that Audrey, who's on this call, has said to our own teams when talking about how we deal with this as individuals, that I thought was very poignant, was don't worry about having to have an opinion on everything in terms of stats and data, and don't worry too much about you having to interpret it. And I think that's an important point to remember as we go through this, but it is useful just to kind of to look at the picture as it stands at the moment. So you will see on the left-hand side the current confirmed cases and deaths. So we have exceeded 40,000 deaths in the UK. And on the right-hand side, you will see the data as shown by the government in their daily briefings. Now, it's a bit of a spiky chart up and down, and this shows deaths by date reported. So in these figures, you will often find a lot of backdated deaths being reported. And even as recent as the last week, we've had deaths in those numbers that occurred back in March. So one of the important things is to realise that you are not looking at date of death. So when you see that the government update, it is not the deaths that happened in the last 24 hours. But I think it's more useful to look at this the rolling average that you will see as the line, which helps you see a bit more what that decline looks like, and kind of takes you away from the weekend reporting. And the positive news to take from this is there is a decline, and since April, the week before Easter, we have seen a pretty much steady and constant decline in the number of deaths that have been reported due to COVID. And for 2 days running now, Northern Ireland and Scotland have reported 0 COVID deaths, which is an amazing achievement in terms of progress that the country is making in fighting this disease. And also relevant yesterday, London hospitals reported no deaths for the first time in quite a while. But it's important to note that the risk to the UK from COVID remains high, but quite good context to think that we are moving in the right direction in terms of progress. And obviously, this is the kind of science. Just bear with me one. Excuse me. This is the joys of working from home with children. So the UK government are still saying that the risk is high, and they're basing their decisions on next steps on the science behind graphs such as the ones you see here. So if I just move on to the next slide, please, Dan. Thank you. I just want to remind you of the statement from the 10th of May, which seems quite a while ago now, that the government updated their guidance from the stay at home to stay alert, control the virus, save lives, with these particular important points, which said stay at home as much as possible, work from home if you can, limit contact with other people, the 2-meter rule still applies wherever possible, wash your hands regularly, and even more importantly is for us not to forget that if you or anyone in your household has symptoms, then you all need to self-isolate. What I've tried to do on the next slide then is just run through some of the updates and considerations that you might need to take into account when thinking about your business going forward. Now, the 4 nations of the UK are now all approaching this in a slightly different way. So some of the things that you will see on here do just apply to England, and Scotland, Wales and Northern Ireland are approaching it in a different way. And each nation is responsible for making those decisions and deciding at what time to move is. Given there's so many moving parts at the moment, it would be impossible to summarise everything on here and to give you that complete full picture. But I just wanted to pull out some of the main ones. So the first one is around avoiding non-essential international travel. So this is quite an important one that has been in for a while in terms of the Foreign Office saying that we shouldn't do international travel unless it's essential. But from the 8th of June, which was yesterday, any return to the UK, they are stating there's a mandatory 14-day self-isolation. So when you arrive back in the UK, you will be checked and have to fill in forms about where your place of residence would be, and you are expected to stay there for 14 days. There's lots of information in the media that this may change within the next couple of weeks, and I think there's a lot of pressure coming in to make this change, but at the moment this still stands. So if you had an employee who had travelled abroad for whatever reason and were returning, they would be required to self-isolate for 14 days. In England, there's the still the ongoing thing that people should work from home where they can do, and they should continue to do that. But where you are bringing employees back into the office, face coverings are mandatory on public transport from next week, the 15th of June. So that is also a consideration that you need to have in terms of people coming into your workplace or thinking about reopening the workplace. Those people who need to be on public transport, you're under no obligation to provide them with a face covering, certainly for them to travel to work, because it is a journey to work. But it's something that you need to bear in mind, that these are the things that your employees are having to consider when making journeys to work. Another key consideration that will impact you and your employees is around schools, because at the moment the lack of childcare provision has quite a big impact on people's ability to actually come back to work. And at the moment, given we are still not allowed to see family and friends inside houses, again, that makes people's normal childcare, what they are reliant on, more difficult. But just to give you the high level, in England, nurseries, reception year 1 and year 6 could return from the 1st of June. Now, there are very different approaches around the country, but some of them have started to go back, and this is likely to be followed by some of the critical years in senior school following within the next week or so. Wales have said at the end of June they will be opening schools for all years, but they will be on a reduced basis. So the hours that children will attend will likely be around a third of the normal time. Scotland have said that they are not looking to reopen schools till after their summer holidays, which is the 11th of August. And Northern Ireland have indicated late August. And obviously in England, we don't have an indication of when schools will open for other years at the moment. And it's just important to bear this in mind when working with your employees if you are intending on bringing them back. And then other points to note in England is that non-essential retailers can open from the 15th of June. So you will start to see a flurry of activity. It may mean that your business can reopen and you've got to start putting things in place. And at the moment, this is very indicative, but the government had originally said that pubs, restaurants, hotels, cinemas, salons, hair and nail may start to open from the 4th of July. There has been speculation in the media that pubs and restaurants with outside seating could open sooner than that. Again, it's just something that we have to watch and wait. But with all these things above, it's important to note that social distancing rules remain, and this 2-metre rule is at the key consideration of opening all these types of organisations and getting the economy moving again. And that leads to a number of health and safety considerations, which Phil will talk through in a second. But for now, I will hand over to Audrey, I think, or is it Phil next? Phil, sorry, I'll hand over to Phil. Seamless.
It also helps that I come off mute. Yeah, so obviously the lockdown has been really, really difficult for most people, but I'm seeing figures now starting to be published that it's actually working, and it's saved millions of lives over Europe, and 470,000 up until early May is the figure that I've seen published. So whilst it's been difficult, and whilst it's difficult for people, it's difficult for businesses, it has worked. So the trick now is, as we release lockdown, is to sort of not put all of that good work at risk. So just a reminder there, people have been on the presentations before these webinars will have seen this slide. UK health and safety legislation requires that we do a risk assessment for all workplace hazards. Coronavirus is probably the first real new additional workplace hazard we've had in decades, definitely as long as I've been doing health and safety. So it's just there as a reminder that we need to do risk assessments, and there's a legal requirement to do them. Not only that, I mean, when I'm teaching health and safety, I always say that the moral reason for doing risk assessments outweighs the legal reason, and coronavirus probably more so than ever, because we need to make sure our staff are not getting ill whilst at work. It's good. It's also good business sense. We don't want our staff, 30, 40, 50% of our staff getting ill and having to go off work for 2 to 3 weeks. So it's really good, important that we do risk assessments, not just because the law says so, because it's good business sense. Do you want to move on to the next slide for us, Dan, please? So I just thought I'd pick up on some of the key points that we need to be thinking about in pubs, because that's the next major industry and that's going to reopen. And a lot of what we're looking at here on this slide will apply to other businesses that are on the session on the webinar. But as Michelle mentioned, the key controls are around social distancing, but also let's make sure that employees who have got symptoms are not coming to work. There's the testing available out there for people that have got the symptoms, so they can go get tested and hopefully get back to work sooner than the 14-day self-isolation period. But we just need to make sure that people who have got symptoms are not encouraged to come into work. We don't want to really be potentially bringing in coronavirus into the workplace. We don't want it to spread among staff. We don't want it to spread around the wider community. One thing that the hospitality and the pub industry are talking about is a potential risk of violence in the workplace. So not a coronavirus directly linked hazard, but another workplace hazard that could affect from this, because our customers pubs customers will not be used to the rules, and obviously we've been into supermarkets and we've seen how it works in supermarkets, 2 meters queuing outside, etc. Imagine those kind of controls in a hospitality pub environment where people have had a couple of drinks or more. So there's obviously a risk of violence that needs to be considered in that kind of thought process as well. Some of the controls for the pub industry, and again, like they say, this mirrors across lots of other industries as well. But fitness to work forms, making sure our staff that have been furloughed for 8, 10, however long weeks it is now, that we do some kind of fitness to work to check whether they've got the symptoms or whether anybody in their household has got the symptoms. Similar to you doing a restaurant or a food chain with somebody coming back from food poisoning, but obviously looking at coronavirus symptoms rather than food poisoning symptoms. Personal hygiene is going to be key for staff and customers. Obviously, we can only influence customers, we can't force them. But personal hygiene for staff, hand washing, wearing PPE, gloves, etc. Look at zoning the work areas. One thing I've also seen is limiting the range on sale. So probably get rid of half the optics or whatever behind a bar so that staff aren't crossing over each other. Make sure that all the staff on a particular point in the tip behind the bar can actually get to everything without having to pass everybody else behind the bar where you've got limited space. So on the back of that as well, review your front of house and back of house layouts, how we're going to manage traffic within the customer areas. Your dishwashers and your hot water supply are now safety critical equipment, because we need to be making sure that those dishwashers are actually washing the glasses at the right temperature. So make sure that they're serviced before we reopen. Look to go to contactless paper. We're not going to like this, but perspex screens on the bars, similar to what we're seeing at checkouts in supermarkets. Get rid of those hot air dryers, replace them with paper towels. There's an argument that says that the hot air dryers, if somebody's not washed their hands properly and they've got contaminated hands, the hot air dryers will spread that virus in the atmosphere within the toilet area. So get those switched off, go to paper towels. Obviously, we'll review that as the guidance and evolves, because the hand air dryers have got a lot more environmental benefits than paper towels. But for now, go back to paper towels. Look at the PPE that you're issuing to your staff, especially your cleaners. There's a potential risk in toilets, so anybody who's cleaning toilets needs to make sure they're wearing really good, strong PPE. Hand moisturizer might seem a strange one, but we're asking our staff to wash their hands a lot more. That means they're removing natural moisture, so dermatitis becomes a risk. So let's make sure we've got the right kind of creams in there to people to moisturize the hands, so we're not drying hands out. And then once we've got all this in our minds as a business owner, as an operator, let's make sure our staff know what they're doing. Staff training is going to be key before everybody comes back to the workplace. I'm going to move on to the next slide for us, Dan. Just a quick reminder there, the Health and Safety Executive and in lower risk businesses, local authority environmental health officers, they will consider taking legal action where coronavirus controls aren't in place effectively. Could issue anything from guidance through to improvement or prohibition notices. A prohibition notice is issued where the enforcement officer believes there is an imminent risk to health. Now, considering we're dealing with a virus that is known to kill people, I suspect prohibition notices will be the tool of choice. And a prohibition notice basically closes the operation until the risk is reduced to a reasonable level. So if a business opens, it's not got all the correct coronavirus controls in place, there is a risk to the business that the environmental health officer, HSE inspector will come in, serve a prohibition notice, which effectively closes the business for 2, 3, 4 days until things are put in place. So it's really makes really good business sense and really important legally that we get the risk assessment in place and we get it right first time, so we're not then having to close down, revisit everything and come back to it later. Do you want to move on to the next one for us, Dan? So I thought there's a lot of talk around face coverings and masks. I thought I'd just quickly cover the difference. And if we move from left to right on the screen, we've got a face covering. A face covering is just a piece of cloth. It can be a scarf, it can be a handkerchief, just any piece of cloth that covers the face. The World Health Organization changed their guidance Friday, I think it was. There's a lot happened in the last few weeks, but they changed their guidance to say that face coverings should be worn in public, especially where social distancing can't be enforced. Now, the face covering is not to protect the wearer. I think I've mentioned this before on these sessions. The face covering is, if you sneeze, that protects, that keeps the mucus from the sneeze or the cough within the mask. So if you're a carrier, if you're pre-symptomatic, but you've got the coronavirus, you are not going to spread that to somebody else. So there's limited protection there to the wearer, but the protection is to the people around the wearer. The surgical mask in the middle is what you'll see nurses, doctors, surgeons wearing. Again, tends to be worn for the same reason. It protects the people around the wearer rather than the wearer. But then we come on to respiratory protective equipment, which is commonly called PPE wrongly in the media, because it protects the lungs, so it protects the respiratory system. There's two types there. They're both P2 masks, which are the ones that the HSE recommend for protecting the wearer from a contaminated atmosphere. The top one is the preferred one. It's got no valve on it. The valve on the bottom mask allows the air from the breath to escape the mask. It is filtered, but it can allow the viruses out. So the top one without the filter is preferred for personal protection. Now, if you've ever worn one of those masks, you don't want to be wearing them for any length of time. The valve stops the mask from getting soggy and clodding. The top ones without the valve will become sodden. So if you are wearing masks, you need a reasonable good supply of those to make sure that you've got enough for people to change them through the day. If we are using masks to protect the wearer rather than people around them, then we need to make sure by law that we've type tested the mask to fit the person's face. What that means is you cannot necessarily go out and buy 1,000 masks of one design and expect them to fit all your staff. You may have to buy 2 or 3 different types of mask to suit your staff. So there's various considerations around which type of face covering and mask you require your staff to wear or you expect your customers to wear, and a lot of thought needs to go into that whole process. And then once we've got them on, we need to worry about taking them off. So do you want to move on to the next slide for us, Dan? It's not as simple as just taking a pair of gloves off. If you're wearing these nylon gloves, obviously if you've touched something, the outside of the glove could be contaminated. So what the picture on the left shows is how to take the gloves off without contaminating your hands. And there's always a risk that when you do take a glove off that you will contaminate your hands. So after removing any gloves, wash the hands or sanitize them. Make sure the gloves and masks, if you're wearing masks, go in a sealed plastic bag and in the bin. Otherwise, all you're doing is contaminating the atmosphere and the air around with potentially contaminated materials. The masks are really good at soaking up the moisture, and they could actually be a breeding ground for viruses. So let's make sure that when we take them off, they're disposed of properly. And again, if we're going with masks, we need to pinch the nose to make sure that they're airtight. And we also need, when we're taking masks off, to make sure we're not touching the outside of the mask when we take it off, because again, that's a contaminated surface. So lots to consider around PPE, not just wearing it. It's how, is it the right PPE? Is it the right mask, face covering, etc.? And are staff trained to put it on, wear it properly, and probably more importantly, remove it and dispose of it properly? But there's a lot there to really think about and how we train our staff on all of that. And I think that's me done. If we move on to the next slide, I think I'm handing over to Audrey. Yes, I am. Thank you.
Thanks very much, Phil. That was really interesting. Morning, everybody. As Michelle and Phil have said, there's a lot of information around at the moment. I've decided today just to concentrate on the changes to the job retention or furlough scheme, because the current scheme ends on the 30th of June. So we are expecting some further updates from the Chancellor later this week and a bit more detail, but we've got some direction which I'm going to share with you. We will try to answer any questions afterwards if we can, but at the moment we've got fairly limited detail. I'm kind of giving you most of what's known at the moment. So the second point on the slide is probably the most important one. There will be no new entrants to the furlough scheme after the end of this month. And this means that because the minimum period of furlough is 3 weeks, tomorrow, the 10th of June, is the last day when you can either furlough someone for the first time or else re-furlough someone that you've brought back into work temporarily. So that's really key. So anybody that come back to a little bit of work for you, or somebody that you think needs to be furloughed, it must be tomorrow, or you won't be able to claim for any non-working period between from now onwards. Claims to HMRC for this last period of the scheme as it exists up to the 30th of June must be made by the 31st of July. So the new scheme, which has actually been brought forward a month into July rather than August as originally announced, it's really on the same basis as before. There are no immediate changes to the financial structure of the scheme, the money that you can claim and how that's done, but employers can bring back workers for any kind of part-time scheme or rotated. This is really significant if you have some work. Many people, including people on these calls and in general, have been asking for this flexibility from the beginning, a part furlough scheme. And we've been telling people over the last weeks you can't part furlough someone. Well, from the 1st of July, you can, and you can claim for furlough pay for the balance of their hours. So what you will need to do is to submit a claim for their normal hours and also tell HMRC what hours they've actually worked and claim for the rest. So the minimum claim period under this new scheme from the 1st of July is to claim for 1 week. Dan, if you could move us on to the next slide, please. I'll just go through what's going to happen after that. So after July, there'll be some more changes where the actual amounts will start to taper off a little bit. So in August, the cap of £2,500 maximum, or 80% of someone's pay, will be the same. But employers will have to pay their national insurance, employer national insurance and pension contributions, and that will amount to about 5%. All those boxes on the right there that have percentages on are rough estimates of the amount that employers will have to contribute for the remainder of the scheme. So in September, the actual cap amount will start to reduce. So the government's worked out a tailing off of its contribution. So there will still be furlough payments available of the lesser of 70% of someone's wages costs, or £2,187.50 maximum. And employers will have to make up the additional 10% plus the national insurance contributions and the pension contributions to the previous level of 80%. And if that all sounds a bit complicated, then that 14% on the right there is basically the difference between £2,187.50 and £2,500. So you'll be paying that extra 10% plus the NICs and pension contributions. And then in October, there'll be a further reduction on the same basis to 60% of wages costs, which effectively means a maximum from the government of £1,875. So employers need to pay everything else back up to the 80%. And of course, this only applies if you've got people on full-time furlough. You may, of course, by then be having people on part-time and hopefully gradually returning to something approaching their original hours. And that will continue to the end there, and the scheme will finally close at the end of October. Going back to August, in fact, 40% of employers haven't made a claim for national insurance contributions or pension contributions. So if you are one of those, then there won't be any change at all for you in August, other than the continued ability from July to furlough people part-time. We don't yet know the details yet of exactly how the claims will work for part furlough, but when you have to top up the money to 80%, that is obligatory, and there will be a way for employees to report if they're not getting the full 80%, but they're still on full-time furlough. So hopefully we'll have some more details the next time we're on a webinar with you all. Dan, if you just pop over to the next slide, please. Just wanted to give you a quick idea of a bit of work that Phil and I have put together that we've been doing for some of our clients. I think, Phil, you've done a huge number of risk assessments for some of our HR clients, haven't you, as well?
Sorry, I was on mute again. Yeah, we've supported about 100 clients so far with their return to work risk assessments.
Yeah, so what we've done is really blend our two services together to provide one kind of really simple package where you can just buy some consultancy time. You don't have to be one of our HR services clients to do that, and we'll help you in any way we can, in any combination of HR and health and safety to help people get back to work. Maybe look at how your attendance policies work around the track and trace system, where people may be reporting in sick for COVID reasons, and looking at, you know, as Phil says, risk assessments for getting people back to work. We can talk with you at a really high level. Whatever you need to do, we can formulate a bit of a package for you on that basis. So you do give us a shout if that's something that might be of interest. And I think that's back to Dan.
Yeah, thank you guys. It's really, really helpful. We have had quite a lot of questions in, so I think we've kind of like just hit the half an hour mark. We will go over slightly, we will get to some questions, but any that we don't answer, we will come back to you post webinar. So I go through one question we've got for pubs, will all staff behind the bar need to wear masks at all times?
I'm going to use the standard health and safety. That'll be down to your risk assessment answer on that one. I think that's a lot of it's going to depend on the size of the bar, how many staff you've got, and there's also going to be rules around how you collect bottles and glasses. The guidance that I went through earlier was a really high level from what I've taken from a trade industry guidance document that they're putting together. It's yet to be confirmed with Public Health England. But there's gonna be a lot of considerations, and I do believe that face coverings behind bars in a lot of situations are going to be a requirement, but in some it won't be. So I don't want to say yes to all. It's going to definitely be down to risk assessment, but the majority of situations, yes, I think face coverings are going to be required.
And I think we'll also have to wait to see if there's any specific government guidance on it. I mean, it's just in the last few days that the government have announced that any staff or visitors to hospitals will now have to wear face coverings. So I think as we get more information about pubs and restaurants opening, then there may start to follow some information around what is expected around face masks and coverings. But in lieu of having any of that, then Phil's answer absolutely stands.
Okay, that's great, thank you. Another question we've got is we have a few employees who should have had their probationary period reviewed during lockdown or within a few weeks. What guidance is out there for dealing with this?
Well, I guess it depends a little bit on the situation, whether they are people who've been able to work at home, in which case there shouldn't be much change. If they've not been able to work for any reason, then it's reasonable to say that you've not had an opportunity to assess their work, and that as soon as you are able to, you should carry out that sort of review period and have a probationary meeting with them. Ultimately, probationary periods are slightly meaningless in some senses, but if it's part of your process, it's important to acknowledge if you do have to delay it because you've not had a chance to work with somebody. Michelle, was there anything else you wanted to add there?
No, absolutely agree. If you've a probationary period in your contract, then you've the right to extend that review to the moment when it's appropriate to do so.
Okay, thank you. Another question we've got is, how do we handle first aid at work when our staff return if we are trying to keep social distancing? our first aiders may be reluctant to come into contact with people needed first aid?
There's been some new guidance out from the various first aiders. CPR, mouth-to-mouth resuscitation, has been frowned on for a while. So anybody who's refreshed the first aid in the last year probably been told to just go with chest compressions anyway, rather than the rescue breaths. As for the rest of it, if we're wearing gloves and we've got disposable aprons, then you're protecting the first aider. The guidance basically says wash your hand afterwards. I would point the first aiders who are reluctant towards the guidance, and then take a view on where that goes with that. But again, it also depends on the level of the injury. Excuse me. So if you're just dealing with minor cuts and you're wearing gloves, shouldn't really be an issue. And first aid is just around that minor injuries, really. Have a conversation, point them towards the guidance, and then see where you go is probably the best answer at the moment.
Okay. Another question. We are looking at moving towards a work from home model. How will health and safety officers do those checks?
Obviously, as you move into home working, we're going to have to start looking. The key risks for home workers are around the workstation and the fact that the home environment might not be as suitable for DSE work as the office environment. So there's a lot of things there to look at. I would say the best way to do that is to look at, even before you make that decision, is to get the potential home workers to do a home worker assessment. We have something on the HR hub that clients can download, do that assessment, and then use that to help make the decision as to whether home working is practicable or not. It may well be that some of your staff cannot work from home safely. They may not have room for an office desk. They may not have room for an office type chair. So that might impact on the whole decision as to whether to go to home working as a mass migration. It might be that 3/4 of your team can work from home, but 1/4 of them can just physically not set that up from home. I'm thinking more here, younger workers who are living in their parents' house, and I'm speaking personally here because my son's moved to home working. And if he was home working long term, that would not be a solution for him, because it would not be practicable for him to have a workstation in his bedroom. So we need to be, before you actually make that decision to move to home working, you need to make sure that your employees can do it.
Okay, that's great. And then I think, just due to time, I think we're gonna, because we have had quite a lot of questions, we're not going to get through them all. I'll leave it as one last question before we close. So last question is, we furloughed a staff member in April and May, but they returned to work in June. Can they be furloughed under the new scheme in July, even if they have worked in June?
The answer to that is very simple, is yes, as long as you furloughed them by tomorrow. And that's the last day when you can put someone back on furlough. So as I said, the scheme closes to new entrants at the end of the month. But in order to be in the scheme at that point, tomorrow is the last day to give you a clear 3-week furlough period run at it. So yes, you can, but move quickly.
Okay, that's great. So anybody that's asked a question and we've not got round to it, I know we've, from looking at there, we've got quite a few. I think the payroll customers asking about payroll system and how when some of the reportings come in. I think some of that is already out, so I'll make sure that you get some more information. Any questions that we've not answered, we will come back to you with an answer either today or tomorrow. So just as we close out, if anybody's after more information, I just wanted to signpost you to our knowledge centre on our website. We update that on a daily basis. We've got blogs, we've got past webinars on there, we've got guides, legislation guides, etc. There's a whole host of information you can find, not just around COVID-19, it's other topics as well. So anybody after more information, please visit the Knowledge Centre on our website. Anybody that wants more information around the services that we offer, particularly the consultancy work that Phil and Audrey mentioned earlier, if you just pop it in the questions, I'll make sure some information gets sent over to you around that product and service. So thank you for joining today. Our next session we will put on for 2 weeks' time, unless something major comes out in the news. But please look out for an invitation in your inbox. Thank you, and hope you all have a great day. Bye bye.